Cool. Great. Thank you. No, thank you for letting me come here and to do this. So as Jason said, I'm the current president of the Utah Medical Association. We typically get a spot here to come and talk about legislative issues and stuff, but there's other things we want to talk about as well. Just background on me, I actually grew up in Ogden. I don't know if any of you older Ogdenites remember the Fred M. Nye Company, the department store that's down on Washington about 26th. That was not my family. That was the rich Nyes. I was from the poor Nyes. My family was on 7th Street between Washington and Wall. So, but anyway, and I grew up just a block north of Ben Lomond High. So, came here to Weber State, graduated in the first year that it was actually a university. So, kind of cool. It's good to see the school kind of going, all the construction, everything that's going on. I walked up towards the top of campus today, and the science lab was just gone. That's where I spent most of my time when I was here. There's no building there anymore. But anyway, so that's great. So I do want to talk to you today about legislative issues. So this is one of the things that Utah Medical Association does is we are up on the Hill. We're working with legislators to try to work on legislation that's going to affect physicians and patients within the state of Utah. Or the practice of medicine within the state of Utah. So we'll go over these kinds of things. There are some things that we are proposing or we're trying to promote, and other bills and things we're trying to fight against and try to oppose for whatever reason. So anyway, as we go along, if y'all have any questions, feel free to raise your hand, stand up, yell at me, heckle, whatever. I'm just going to go through this. So I do have to admit, I plagiarized the slides. Okay. Okay, can you all hear me now? Is that better? Okay, we're good. Thank you. I hate having to hold a mic like that. So I did plagiarize the slides. Our CEO, Michelle McComber, put them together. I stole the slides, put my name on it, and changed the picture. So I admit, yes, they're plagiarized. Sometimes when we go to the legislature or in other situations, this is kind of what we feel like. But if you look at this kid, what do you see? What do you see in this little guy? I don't know. He's just looking up. I think he's sizing up his competition. This kid does not look afraid to me. He's just going on. So hopefully we can go on and get into this, be fearless. Okay? Are you guys still hearing feedback? Is it? Okay. I'm going to go ahead and hopefully our sound guy can take care of this stuff. First bill, House Bill 301. This is a medication dispensing amendment. What this is a piece of legislation that we proposed, and this actually came from our House of Delegates. Oh, let me back up just a little bit. Who understands what the House of Delegates is for the Utah Medical Association? Okay, so there are a few hands up. What the House of Delegates is, this is the policy-making body for the Utah Medical Association, okay? We get together, there are representatives from different county societies or some specialty societies, and they all get together and they put forth resolutions, they vote up or down, they pass or fail, whatever passes, then becomes UMA policy. And if there's something that's legislative like this is, okay, this came from our last House of Delegates, we put together a piece of legislation, got it passed through our legislature. So what this does, and this is sponsored by Ray Ward, who's in Bountiful, and Senator Kennedy, who's also a family practice doc down in Utah County. This allows physicians to be able to dispense medications from the office. But it's not going to be controlled stuff, so it's legend medications. It has to be prepackaged, has to be for an acute condition, lasting no longer than 30 days, and the patient has to be seen on the day the medication is dispensed. Also, there are a few other rules that are going to come into play from DOPL, is that the clinic or the prescribing practice has to apply for a license, a prescribing license, and they have to have one person in charge of that to kind of oversee all the compliance and rules and regulations and stuff like that. So what this does for certain practices, it actually allows you to be able to get your patient's medication. They don't have to go to the pharmacy, but they will still have the option to do that. They don't have to take the medication from the prescribing practice there. But anyway, it's just another way, an easier way to get patients medication without that extra step of having to go to the pharmacy and stuff. HB 344, the Candor Act, okay? We all know there are bad outcomes sometimes. As much as we try to prevent it, it happens sometimes. And we also probably all understand that lawsuits don't necessarily come from bad outcomes per se, they come from people being pissed off. So what this does is creates a pathway or a venue or an opportunity for a physician or practitioner to be able to talk with the patient in a setting that is not necessarily inside of a lawsuit. So the patient can have their attorney, the docs can have their malpractice provider and attorney or whatever there, but basically go in and say, look, this is what happened, this is why it happened, this is how it's never going to happen again, and kind of what's going on with that, and have the patient or the representative be able to ask questions in this type of setting. Now, the cool thing about this is oftentimes if it may be resolved just with that, and there may be a settlement offered that they may accept at the time, that's okay. If it does go to a lawsuit, then it's voluntarily on both parties, okay? So the patient can back out at any time if they so choose to do that. And if it goes to lawsuit, the conversation or the information that comes out in this meeting is privileged, okay? Will not come out in the lawsuit. So, yes, you had a question?
I feel like this process within my practice and things like that, is this just additional protections for us as physicians if we have that kind of intervention, or is this more formalizing that process that it can and should be happening?
Yes. Yes, it just kind of formalizing it, giving another avenue so that can happen, but also giving you the protection so that what you come out. So if you're doing that now, what you're saying in a sense could be taken as an admission of guilt, possibly, if it comes out in a lawsuit later on. Whereas with this, that's now privileged communication. That's protected. Okay? Again, this is another thing that came from our House delegates. So, all right, HB 295, Physician Workforce Amendments. This is a bill to provide extra funding to expand residency programs. There are a bunch of docs coming out of medical school that can't get into residency, so we need to expand residency programs. But this one specifically lays out we need a fellowship for forensic psychiatry, specifically for that. So the funding on this is $5 million up front, then $2 million per year ongoing after that. Next one, Senate Bill 185, Children Health Coverage Amendments. Oh, and that one passed, sorry. The health coverage amendments. This was to expand health care coverage for children up to about 138% of the federal poverty level. This is also another resolution that came out of our House of Delegates meeting that came forth, and then we went through the legislature. The sticking point on this was, you see that bottom line where it says the immigration status. And so what came out of the House is like, that should be for all kids regardless of their immigration status. And that, like I said, that was kind of a sticking point. Went through the Senate, but did not make it to the House for discussion or vote. Anesthesiology Assistant Licensing Act. This creates another category, in a sense, anesthesiology assistants. And this is from the Utah Anesthesiology Association. Basically what it is, this is a physician's assistant specifically for anesthesiology. So that category, and so this anesthesiology assistant would be working under an anesthesiologist under their supervision, like I said, just like a physician's assistant, but specifically for anesthesiology. Yes, sir. No, this is anesthesiology assistant, separate from the CRNA thing.
What's the difference?
It's like a PA instead of a CRNA. Is there a difference from that?
Much less training.
But the training is specific to anesthesiology with the anesthesiology assistants. Okay? HB 32, Healthcare Worker Protection Amendment. In a sense, this is kind of like a hate crimes legislation for physicians or healthcare workers. Basically, it adds enhanced penalties for anybody who assaults or threatens a healthcare worker in whatever kind of setting. I know this is kind of a bigger issue probably in emergency rooms when sometimes tempers can get fired up and can have some issues with that. But basically, like I said, it's enhanced penalties for threats against healthcare workers. And of course, that passed. Okay. Oh, and these bills, on this first category, these are bills that we kind of supported or helped push, okay? This is another one, the Utah Inland Port Authority. Who's familiar with the Utah inland port? Okay, it's basically a port out west of Salt Lake City. Just like a port on the coast, you get a bunch of stuff, the ships come in, then it gets distributed out from there. And that's going, but when it was put up and kind of getting going, it didn't necessarily have a human health risk assessment. So that's what we're trying to push for with this legislation, was that there would be a human health risk assessment done on that. This also modifies provisions for the Port Authority and who's going to be on their governing body to include other people within Salt Lake County, not necessarily the business leaders or government agencies. Of course, we want to encourage and, as it says, encourage, incentivize, require development that mitigates noise, pollution, light pollution, surface and groundwater pollution, and other negative environmental impacts. There'll be $40 million ponied up for that too. Okay. Did somebody have a question or comment over here? Okay. HB 80, Diabetes Prevention Program. There's a certain national diabetes prevention program that's been developed by the CDC, and so this provides reimbursement for a provider that has a patient enrolled in the diabetes prevention program. When I heard about this, it's like, wait a minute, as a pediatrician, I kind of tell kids, get out and ride your bike. Go walk your dog, do something. That's my diabetes prevention, or at least the start of it. I'm working on it, so I don't know if I get paid for that. Okay, HB 384, anesthesia and sedation amendments. This is for anesthesia and sedation that are done in an outpatient setting. So for example, in a dentist office or an orthodontist office or a physician's office is doing procedures as an outpatient, if you need to have some sedation. This basically sets out who can do it. Needs to be a physician and not the doctor who's performing the procedure. Has to be a separate person, or a CRNA, somebody who's trained to do anesthesiology. And it sets the parameters as far as what's deep sedation, moderate sedation, light sedation. So basically kind of lays that out. And of course that passed, so we can do it. Okay, this next set, these are bills that we're kind of either neutral, had no real stance on, or tried to oppose, okay? And when we talk about some that are opposed, we'll get into what was the opposition and what we did for it. The vaccine passport amendments. This was Senator Kennedy, even though this is a House bill, Senator Kennedy was kind of pushing this. And what he wanted to do was he wanted to say, we are not going to have anybody mandate a vaccine passport or vaccine status. We're just not going to do that. And it was somewhat of a preemptive strike from other stuff that may be coming down from the feds. But anyway, what he wanted to do, but businesses across the board were against this, okay? Because businesses should do what the business feels they need to do for their own business. So it would have enacted a prohibition on the use of immunity status, and specifically, well, it was done for the COVID vaccine thing, but it didn't specify that in the bill, and this would have been for any vaccinations. Unless you have CMS, you work for a company like a nursing home or a hospital or a clinic or something like that, where you take Medicaid or Medicare. So again, there are certain exemptions for that, but Kennedy, like I said, he was wanting to not allow or disallow any business from requiring that, and that failed. So, and then the next thing, which is kind of related, COVID-19 vaccine exemptions. Now the state of Utah already has vaccine exemptions in place for either a medical exemption, religious exemption, or personal exemption, which would cover basically anything else. Somebody's saying, nah, I don't believe in vaccines, I don't want to do it. But this kind of lays out in statute, requires an employer to exempt an employee from the COVID-19 vaccination based on any of these exemptions if they get a letter from the physician saying they should not get the vaccine, or if they have one of the other exemptions, their religious or personal exemption. Also says you can't separate an employee of a government entity from another employee solely based on their COVID-19 vaccination status. It says the employer can require proof of the COVID-19 vaccination without an exemption if the employer establishes a connection between the employee's assigned responsibilities and duties, okay? So if you're out swabbing people for COVID testing, okay, you should probably be vaccinated. And that one, of course, passed. HB 116, medical billing amendments. What this one did was, or wanted to do, was basically prohibit physicians from, or any provider, from billing more than 90 days after the service was rendered, whatever it was. It's a surgery. So if you didn't get that bill sent out within the first 90 days, then you're just out of luck, you can no longer bill. Unless you can show that you tried before, you tried to bill the insurance company or whatever. But there are all kinds of issues with this, because it may be like with OB. You may have a patient who comes in, and with that thing, you don't bill until the end anyway. But if that woman jumps ship and she goes to somebody else, and you may not necessarily get the billing done at that time, there are all kinds of other caveats, and we all know that there are issues with billing. They get somewhat complex in time. And so we pushed back against that one, and that one failed. I'm sorry, I know this is kind of, this time in the afternoon, as a pediatrician, I wanted to have milk and cookies for everybody this time in the afternoon going, because this is going to be tough to go through legislative stuff going, So I tried to get milk and cookies, but Weber State's kind of territorial with their food service and stuff. So anyway, sorry. Okay, HB 127, medical practice amendments, okay? This one's a little bit controversial, a little bit weird. What it is, this bill would have restricted, quote, medically unnecessary, and quote, puberty inhibition procedures or a sex characteristic altering procedure on a minor. So basically, they wanted to prohibit any kind of hormone therapy or anything like that, say for transgender or whatever other reason there was, okay? The problem with this was that, well, there are a few different problems with it, but one, the medically unnecessary was not really, it's very ill-defined. And who knows, and they wanted to put restrictions on this to cover all kinds of things, not necessarily just gender-affirming care and what was going on with that. So this is a bill that did not make it out of committee. Again, you may oppose that. Didn't make it out of committee, so successful in that. Wow, I'm kind of blowing through this, huh? Whew. All right. My mantra is it takes a really good meeting to beat no meeting at all. So we're good, okay. HB 167, Mental Illness Psychotherapy Drug Task Force. This is in response to the medical marijuana issue. And kind of that came out. Just because through a public referendum is not the way to bring any drug out to market to be used. And there are other drugs that are going to be out there. And so this would be, this piece of legislation, what it does, creates a task force that will be charged, and this is going to be done through the Huntsville Mental Health Institute, to look at other substances. Are there any benefits in treating mental illnesses, any kind of mental health illnesses? And this includes psychoactive stuff, LSD, and whatever. Is there any benefit? But the studies will be done in a controlled environment. They're going to be scientific studies. It's not just going to be public opinion, what you read on Facebook. So it, again, establishes task force to be able to look at these drugs, these controlled substances, or Schedule I, possibly. Is there any benefit? Is there any scientific evidence that any of these drugs are going to be helpful in any kind of mental health issues? And that, of course, passed, okay? The Associate Physician License Amendments. Who knows that Utah has a category of physician for us called Associate Physician? Anybody know about that? You did back there? Okay. What an associate physician category is for some of these docs coming out of medical school who don't get into a residency for whatever reason. If you don't get into a residency, then what do you do? So in Utah, you can get a special category in your license called an associate physician, and you can practice under a licensed physician, under their supervision, and then while you're trying to go back and get into a residency program. It started off as being 4 years. A couple years ago, it was expanded to 6 years. This year, Stuart Barlow wanted to bring it up, and I know Stuart, I saw him here yesterday. He's my legislator, and I called him up and I said, Stuart, I don't think this is a good idea. He wanted to make it just kind of indefinitely. So there was no limit on it, which basically would have created a total other class of physician, which would have been put that person out of medical school about an equal par with the physician's assistant. Because, you know, you have to work under another physician, under their supervision, and with that kind of somewhat of a collaborative agreement. So what this piece does, we kept the limit on it at 6 years, and these are some of the changes that UMA made, kept the limit at 6 years. We took out some of the specific supervision requirements as far as like how many chars, kind of laxed that up just a little bit. But as I said, it would have done away with the limitation on the years. And also, initially it was limited, that physician or associate physician was limited to primary care. And it took away that restriction so they can work under some type of specialist. Okay, then we get into every year, these kinds of things come up too. Scope of practice things, yes?
Associate physician, were they required to have a rotating internship or nothing after that?
They're not required to have rotating internship. And that used to be able to get a license, you just had to have that 1 year rotating internship and you could actually get a license to practice as a physician, whatever. But that's just it. These guys or gals, these people are coming out of medical school and not getting into residency. So that's why they're still required to work under a licensed physician, under their supervision. Okay, somebody else have any other questions? Okay. All right, scope of practice bills. These kinds of issues come up every year. And as UMA, we fight back on these kinds of things for various reasons. The first one, naturopathic physician amendments, okay? The naturopathic doctors wanted to be able to prescribe anything, including controlled substances. And so as UMA, we said, no, I don't think that's a really good idea. And I don't understand why. I mean, they already have the ability, they can prescribe testosterone and use that, which I don't understand because as a naturopathic physician, I thought they're kind of opposed to that kind of stuff anyway. But anyway, what the bill wanted to do was to get rid of the formulary that they had and just be able to prescribe whatever, again, including controlled substances, okay? And so we kind of pushed back on that and we said, no, I don't think that's a good idea. So we limited it, there's no expansion of controlled substances. What they are limited to do is what the FDA categories already allow, they say they can do, and it's nothing that they weren't already allowed to do anyway. But we kept that within the FDA categories. Part of this piece here is for Utah then, is they cannot expand into any new drug category unless it comes out and the FDA puts out that new drug category and it gets approved by the Utah Physician Licensing Board and the Utah Naturopathic Physician Licensing Board. So it has to be approved by both of those boards and come down from the FDA, and then they can be able to prescribe that. And again, so it passed, but again, these are the amendments that the Utah Medical Association kind of worked for that, made it so it's something a little more acceptable, more tolerable, and then it passed. Chiropractic practice amendments. Chiropractors want to be able to use imaging, X-ray, CT, MRI. By use, I mean order, read, interpret, use them for diagnostic purposes, whatever they're going to do. And again, we thought, probably not a really good idea to have the chiropractors doing that. So they can, we got some amendments in and made it so they can order imaging, X-ray, CT, MRI, whatever, ultrasound, but they cannot interpret the results. They can't read those things. So it can be read by a radiologist, okay? Sorry? Use, yeah, like interpret the imaging. For example, like if I have a kid in my office, to break their arm, I can do the X-ray, I can read the X-ray, and I can say, yeah, you've got a radial fracture, cast some stuff like that, although it's still gonna be read by a radiologist, but I can use that X-ray, like that. Naturopaths. What's on the FDA category that says they can do it. But yeah, kind of weird, isn't it? Kind of weird. But again, with this piece of legislation, it didn't allow them, we didn't necessarily add anything into what they could prescribe. That legislation was stuff they already had access to anyway. But I'm as confused as you are. It's like, why do the naturopaths want to have access to all these drugs? Because I don't get it. Okay. APRN compact. So what this is, there are anybody licensing compacts, okay? There are different compacts even for physicians, so certain states will get together and have a compact or an agreement between the states. And so I know there are physicians who will do this, and so what it does, it makes it easier to get licensed in different states. And so if I'm licensed in Utah, and Utah has a compact with, I don't know, Colorado, Idaho, Wyoming, Kentucky, whatever, then, and if I want to get a license in one of those other compact states, I can do that very easily, okay? Or vice versa. If somebody's licensed there and they want to come to Utah and get a license, it's easier to do. But at the present time, that person still has to comply with Utah law and the Utah statutes as far as practice rights and all that other stuff for licensing.
I don't get it. I thought polio passed in tiny doses. What churches, right?
Yeah. I don't get it either.
They want to do.
I don't know. I've been asking that forever. Which is why, as UMA, we keep pushing back saying, no, you shouldn't be doing controlled substances. You shouldn't be doing that kind of stuff. So with the compact, the APRN compact, they want to have like a national compact that's set by a national APRN organization. And what they wanted to do, what the language was initially, was that compact language would supersede or override any state's laws. And so even with physicians now, when they have the compact, you still have to comply with the state's laws, and the state's laws are still going to trump that, but they wanted this to trump that. So whatever the national organization said would go, if that compact were to go through like that, then that's what the nurse practitioners would be able to do in whatever state, regardless of what those state licensing laws are. And so, again, we don't want any national organization to override the state's autonomy and the ability to set its own rules and regulations for professionals. So we got the language changed that basically takes that part out of it. There's a compact. If you want to do the compact, that's fine. But that compact is still not going to supersede Utah state rules and regulations. So we got a letter from DOPL saying that it's not going to override Utah. With respect to supervision, collaboration, prescribing rights, all those kinds of things for APRNs. Okay. Optometrist practice amendments. Another scope of practice thing. The optometrist, in their statutes or in their their practice abilities, there are certain prohibitions. And right now, at the Optometry Practice Act, it says they're prohibited from doing surgery. Among other things, there's a list of prohibitions. And they wanted to strike out surgery. So the optometrists wanted to be able to do surgery, different types of laser surgeries and things. And they had some other kinds of things. So again, as UMA, and together with Utah Ophthalmology Society, pushed back against that, worked with the legislators, got some amendments made, and kind of changed that. So that one did not make it through. It passed in the House, but we got it stopped in the Senate. So did not do that. And the last thing on this part is athletic trainers wanted to directly bill. And again, athletic trainers used to be, when they first started up, they were employees of, say, an orthopedist or a physical therapist. And so they're kind of working under them, in a sense. And then they said, okay, well, we want licensure. So they got licensure. They're practicing somewhat independently, licensing. But they're still usually working under somebody else, an orthopedist or a physical therapist, usually. But they want to directly bill their services without having to come under the umbrella of a supervising physician or physical therapist. Again, we didn't think that was a good idea, and so that one was stopped. Didn't make it out of committee, I don't think. So anyway, as far as the legislative stuff, that's what we got. Boy, I kind of blew through that really fast. Sorry, hopefully I didn't put too many people to sleep. I know it's kind of a tough topic to stay awake through. Anyway, if you have any questions or anything, get a hold of Michelle McComber. She's our CEO of the Utah Medical Association. That's my phone number up there. If you want to send me a text, give me a call. If you have any questions or anything else like that about this stuff, I'll be happy to talk with you. Now, what I'd really like to talk with you about now, So we talked about the House of Delegates meeting before, right? So you understand the House of Delegates is the policy-making body for the Utah Medical Association. We saw some of these bills that went through that were bills that the UMA kind of sponsored or supported came from our House of Delegates. And so our House, like I said, we get together, there are resolutions that are proposed, they're voted up or down, they're debated, discussed, whatever. We go through that whole discussion, and then what gets passed out of the House of Delegates becomes UMA policy. Okay? This last House of Delegates happens every September, usually the second weekend in September. Our last House meeting, I was looking at the numbers, the registered delegates. There were 179 registered delegates. I don't know if they were all in attendance, but at least that was registered. 92 of them were from Salt Lake County. So with that, my contention is that whatever comes out of the House of Delegates meeting, whatever gets voted up or down, is not representative of the state of Utah or the physicians in Utah. It's representative of physicians in Salt Lake County. So my plea, okay, this is my recruiting speech now, okay? You got the paper that talks about the House of Delegates. We need representation from other parts of the state. We need people from around here. We need people from Cache Valley. Last week I was in Richfield talking to docs down there. We need other people involved in the House of Delegates from the rest of the state. If we get overrun by people in one geographic location, then we're not representative of the whole state. And as an organization, we lose relevance, we lose influence up on the Hill, and we lose membership. Because the other people around in all the other areas are thinking, they're not listening to me, I have no voice. So I'm trying to come out and say, we have a voice. We need your voice. We need people to come. There are all kinds of different ways to get signed up and register and come participate as a delegate. It's by, there are various ways you can be a delegate. So it's either by, through your county society, okay, and, or your practice. So for example, I'm with Tanner Clinic, and I think we have enough docs now. We have like 4 delegate spots. And I think last year we filled 1 of them.
That was because of the number of docs that you've got at your clinic?
Yes. Yeah. And so same thing with the county society. So if you have a county society under the Utah Medical Association, like Weaver County Society, I don't know how many docs they have, but you get a certain amount of delegates per membership there. But that's not the only way. There are other specialty societies. It could be the Orthopedic Society. It could be the Pediatrics, American Academy of Pediatrics Utah chapter. It could be the Ophthalmology Society. It could be, I mean, everything, OB-GYN. Yes, yes, that's true. But if you take out all the numbers, there were more unfilled spots from the rest of the state than there were for that area. And so they actually did a good job, call to action, they brought people out, and they played the game very well. So, but you're right, it is a population center. But again, my concern is that if we go like that, then we turn into Oregon, where the whole state is run by the people in Portland, and then you have 15 out of the 19 counties there who want to leave and go to Idaho. Yes. Okay, that's a good point, a good question. Did everybody hear that? I barely did. So what he was saying, he's been a delegate before, and he was frustrated because he said what happened is when they brought out to the floor for the final vote, things that had already been, as you said, decided in committee. The way the House of Delegates meeting works is the resolutions get put up and they're going to get put to a reference committee. And you can go in there and anybody can go and testify and talk and you can debate and put up the issue and stuff. Then that goes to the reference committee chair or the reference committee and the chair. Then what happens is the next day, that comes back to the floor of the whole House in its entirety and gets discussed again. So the reference committee will put forth their recommendations. And they say, we recommend that this resolution be passed, or they may say, we recommend this resolution may be amended to read such and then passed, or whatever the recommendation is. They may say, we recommend this resolution not be passed. And so that's the recommendation that comes out of the committee. And then the whole House has the opportunity then to discuss, debate, and vote on it as a whole body. So I can see your frustration. You think, wait, we hashed this out yesterday. Why do we have to do it again today? Well, yeah, you can see he was saying that it seems like he may not necessarily have much of a voice or much of a say in anything because it seems like things have already been decided. And I can see that, but in honesty, it doesn't, the recommendations from the committee, the House doesn't always follow that. They may vote against what the committee recommends on any particular resolution. And so that's why it comes back out. It's not necessarily decided in committee. There are recommendations made, but then it comes back out to the whole House, and the whole body is going to vote that resolution up or down with or without amendments or whatever those amendments are.
Can I speak for a minute?
Please.
So, Scott Peterson,
There's like a mic.
no, I think I can talk loud enough. I'm the Utah County Medical Association chair-elect for the members here. I've been probably the last 4 years on the state arguing against some pretty critical issues that we've had up there. And speaking to what you noted, several times now in committee's come up with what I thought was a reasonable amendment to what was presented, or it's thrown it out completely, and then on the floor, there were the delegates on the floor to actually push things through. So I have to agree wholeheartedly that what the state wants as physicians is not being represented through the Utah Medical Association in every instance. Now, it's also very valuable to have others' opinions when they're talking about things. I have to admit, I've learned a lot when I've been participating in some of these events. Yes, there's a little frustration because it's a political run entity. And I don't think anybody that participates in a political run entity doesn't experience some frustration. Because you do get that variety of opinions that sometimes don't make sense in your own mind. But if you watch the process through, it is very helpful. And I echo, whoever can come to be delegates, we need delegates. We need people representing where you're at. So that reasonable resolutions will go through. We are not voting for things in the state. We're voting for what will go to the state and be argued in behalf of all physicians in Utah.
Thank you. So what he said is true. Again, that policy, what comes out of the House becomes UMA policy, and then that's what, if it's a legislative issue, that's the stance we take to the legislature. And I'll give you an example. I wasn't necessarily going to go there, but you know what? I'm going to. Because Roe v. Wade and the whole leaked thing and what may be going on with that, this is going to be an issue. In our last House of Delegates meeting, well, let me back up a little bit more before that. The UMA stance on abortion has been neutral forever. Okay, we've had a neutral stance, neither in favor nor opposed to that. And whatever your personal beliefs are on this is not necessarily too much into play here, okay, or my personal beliefs. But the UMA has had a neutral stance. The reason for that is because it is such a divisive issue. And if you take a stance one way or the other, you're going to alienate half of the people, whether it's in your own house, whether it's in the legislature, or whatever. So to a certain degree, that's somewhat of a political move. We have to retain our political capital and what we can do up on the Hill. Again, if we don't, we lose relevance and we lose influence up there on the Capitol. What the UMA is doing up there, as he said, is promoting stuff that can be beneficial for physicians across the state. Okay? It's not just UMA, all the docs everywhere. We're doing what we can for the House of Medicine. So, in our last House of Delegates meeting, there is a resolution that came up that said that the UMA would oppose any restrictions on abortion under 13 weeks. Okay? It went to committee. The committee came back and they said, we recommend that this resolution not be passed. And just as he said, there were enough people out on the floor, it got discussed and debated and thrown out, and that resolution passed. So here's the thing. If the Supreme Court comes out and overturns Roe v. Wade, Utah already has a trigger law in place that would disallow abortions after 6 weeks. Or I've heard even just disallow, other than for the health of the mother, for fetal anomalies, those legitimate reasons, rape, incest, okay, legitimate reasons for an abortion, okay? But otherwise disallow that. Now as UMA, because that's our policy, we have to go to the Capitol and argue against that, argue for not imposing restrictions under 13 weeks, okay? Again, whatever your stance is. And so that's just one of the issues. There are issues that came up. Is that going to come up in our House this year? I don't know. But I guarantee there'll probably be something that come up in the legislature. So that happens, and they're going to come and they're going to be looking for us for something on there. And whichever way we go, I talked with Stuart Adams, who is my senator. He's also the president of the Senate, and talked with him, and he said, this issue is not necessarily going to be it's not going to be decided by doctors. Unfortunately, it's going to be decided by legislatures. Now, whether that's the way it should be or not, I don't know. That's the way it is, because they're the ones who kind of in control. So if we want to have any influence, any sway, any control up on the Hill, we need to have representation from the whole state. We need to have everybody's voices. And so I would encourage you, look at this paper. It talks about delegates' requirements and how to be in there and what the delegate does and how important that is. And I would love to see more people up there from the rest of the state of Utah in our House of Delegates meeting. Our House meeting is this September 9th and 10th, Friday and Saturday. We're going to be at Thanksgiving Point. It's actually really it's really cool and interesting process. Kind of cool thing to go through. Does anybody else have any other questions? No? All right, cool, thank you.